I just wanted to say a big thank you. Ellen Henderson at the back of the room did all the organizing of this and did a fabulous job. So thank you, Ellen, very much. Yes, and Susan Wells as well has helped with this. And I also wanted to say a thank you, though the provost is not here. I need to thank the provost for many years of support for DCARE that's really allowed us to bring people together time and time again. And I hope it's resulted in good networking and some synergy that's moved people into new places. So, with that, it is my pleasure to introduce Dr. Mark McGovern. Many of you know Mark. He will be moderating this afternoon's session. It's really particularly exciting for me because it was 10 years ago this month, 2004, that I came to the first Dartmouth Symposium on Substance Use. Mark was the first director of the Dartmouth Center on Addiction Recovery and Education and convened the first symposium on substance use to bring people together. So I remember that well, and it was a great start. So thank you, Mark. Mark is a psychologist and a researcher in the field of evidence-based treatment for co-occurring disorders. He is a researcher. He's also active in clinical care. He's probably known, perhaps indirectly to many of you here, as being the lead developer of a series of organizational measures that assesses the capacity of organizations to do dual diagnosis treatment. These are used widely across the United States, and I suspect some of your clinics have assessed yourselves using the tools. The DCARE, which is the dual diagnosis, help me, Mark, capability in addiction treatment, and a similar one for mental health and dual diagnosis, and for dual diagnosis in healthcare settings as well. Very valuable tools that I think have improved quality of care. Excuse my glasses. His clinical research has focused on translating evidence-based treatments for co-occurring disorders into clinical settings. He's been funded by NIDA, R01 NIH funds, and a variety of other sources, Robert Wood Johnson and others. He's also the editor-in-chief of the Journal of Substance Abuse Treatment, which I'm sure you know is a very respected journal, really leading science and research in the field of addiction treatment, and he's held that position for 5 years. Mark has always been a great support to DCARE, though he left many, many years ago. He serves on our executive committee, and he is always a source of really focused and good ideas and support to our work. So welcome, Mark, and thank you for moderating this afternoon.
Good afternoon, everyone. It was 10 years ago, actually. It was May 21st, 2004, that we held the first Dartmouth Symposium on substance use. And I think our goal was to address the culture of substance use here at Dartmouth and in the community. So I guess we can check that off. We did that. No need for the president to convene a panel of any kind. But I was also remembering that the plenary for that session was delivered by someone referenced earlier in Dr. Burnett's talk, C. Everett Koop. And for those of you that don't know, C. Everett Koop was a Dartmouth College man, graduated in 1937. And when he presented at the plenary, he told the story that this room was actually the dining hall for all the students at that point. And I don't know if this is a great story, but he said that they had the practice of tossing their forks while they were at the dining table up to the ceiling and to see if the fork would stick in the ceiling. And some of them would, and they'd slowly fall down on the unsuspecting other diners. So that's what used to go on in this very sacred room by our former Surgeon General, who was, and I think that side of him actually helped in him and his future work challenging the tobacco industry, challenging the authority of tobacco industry and really public health at the time. And I think we are all the beneficiaries of that. I'm an old enough fellow to think about technology with some suspicion. even though I think Lynn talked this morning about how everyone is on their smartphones pretty compulsively, and I certainly would fall into that category. But one of the things that I've often heard people say is that addiction is a process of increasing isolation, and recovery is a process of increasing connection. So, isolation, connection. So I think as I listen to the speakers who are going to be presenting this afternoon, I would hope that they would address that kind of dynamic. To what extent will technology foster a connection, or will it kind of perpetuate isolation and avoidance? So I think that's a really critical dynamic. And of course, as audience, you draw your own conclusions.